And it is a pleasure to talk to you today about sleep in the aged population. The motivation of developing the Memory Center at Norton Neuroscience Institute really came from my looking at the Norton Neuroscience Institute 2 or 3 years ago and realizing that we had a big gap in our program here. So three of us, Brandon Dennis, myself, and Courtney Ware, who was with us at that time, started this. And you might wonder, well, why is a neurosurgeon involved with dementia? Well, I think it was just an area that was needed in Kentucky and at Norton Neuroscience Institute. So I became very involved with that. And it's been a very exciting field, not only from a clinical care of patients, but also from a standpoint of research in looking for cures and how to prevent the development of Alzheimer's disease, which is a passion to me. One of the areas that I became very involved with has been in sleep. And there are 4 main areas which prevent the development and can delay the development of Alzheimer's disease. And that is sleep, perhaps being the most important one, but also diet, exercise, and social contact between patients and their loved ones. And I think if you take care of those things throughout one's life, then it's very important to follow. The rules are simple, but very, very hard to follow in actual life. So to give an overview of what I'm going to be talking about, this is a complicated slide. We're not going to go through this, but on the left side, we'll talk about normal aging. And then as time goes on, you get to a preclinical dementia. These are people that have changes occurring in the brain. And Alzheimer's disease is not a disease of 65 and 75 and 80-year-old people. This is a disease that begins in 20s, 30s, and 40s. And if people are able to take care of themselves and do the proper things during that phase of their life, then they really can delay or even prevent the development of Alzheimer's disease. So the preclinical dementia is that stage in which the pathological changes are developing in the brain, but have not yet manifested themselves as presentations of memory loss, language disturbance, behavior changes that we so well know as part of Alzheimer's disease. Then as that progresses, you get into the mild cognitive impairment group. And these are patients that have very minor changes. You know, they forget where they place their keys. They may get lost while they're driving a car. Very minor changes, and it's just attributed to part of aging. The brain is getting old. But that very often progresses, not always, but often does progress into a full-blown Alzheimer's disease. And these are the patients that progress on to death within 4 to 10 years after the onset of Alzheimer's disease being made. So this is a very complicated slide here, and we're not going to go through all this, but it shows that at the very beginning of it, one of the major parts is sleep disturbances, sleep fragmentation. Then you go through these various changes in sleep, and we'll talk a little bit here about the pathological changes that occur in the brain still during the normal aging, and even the triad of the tau accumulation, the amyloid deposits in Alzheimer's disease, and the synaptic damage as the beginning of the preclinical stage. But as these changes occur in the brain, they become very profound. And finally, with the onset of Alzheimer's disease, these can all happen. And this is in the terminal stages and the late stages of Alzheimer's disease. But realize that it may start from sleep deprivation early, passes through all these changes as we go down in the slide. But what's intriguing is that when you get to the bottom here and you've developed Alzheimer's disease, then that can in fact have an effect on sleep itself. So it's a bidirectional process that occurs here. Sleep deprivation early in life and throughout life may be the cause of Alzheimer's disease, taking this pattern. But once you have developed Alzheimer's disease, it may reverse so that sleep patterns are disturbed in patients with Alzheimer's disease. So this gives an overview of what we're going to be talking about. We'll answer the question of why we sleep. What are the risks of sleep deprivation? What are some of the mechanisms of sleep? What happens during sleep to make people feel rejuvenated and bright and alert after a good night's sleep, and why people have a foggy mentation if they don't get a full night's sleep. And finally, we'll talk a bit about how to improve sleep patterns in patients and in all of us. Well, why do we sleep? Well, the facetious response is because we're tired. Well, that doesn't answer many questions at all, but it does have secondary effect on conferring many health benefits. It helps out rejuvenation of faulty cell repair, both in the heart, in the brain, in the lung, and in all parts of the body. You have to help sleep for those healthy cells to rejuvenate themselves. And it's also critically important in establishing new memory and learning processes. As we'll learn a bit later, the new memories that you've learned that particular day before you go to sleep, those are new memories that are picked up in the part of the brain called the hippocampus. But that's only short-term memory. That'll be lost. And while you're sleeping, those short-term memories are transmitted and transferred into long-term storage throughout specific parts of the brain, particularly the cortex of the brain, the frontal cortex. So the learning process and instilling things that you've learned the previous day actually takes place in long-term memory while you're sleeping. But that occurs primarily during the first 4 hours of sleep, but the last 4 hours of sleep in an 8-hour requirement prepares you for the following day. It increases your curiosity the next day. It improves your concentration and inquisitiveness for the following day. So the first 4 hours is spent in accumulating what you've learned the previous day. The final 4 hours of sleep prepares you to be effective the following day. Sleep requirements vary greatly throughout life. And for all of those of you that have had newborn children, they require 14 to 17 hours of sleep, enormous amounts of sleep. The majority of the day is spent sleeping. And even up to 1 year, it becomes a little bit less, but not much. But look at this with a preschool age, 10 to 13 years, and even in school age children, 9 to 11 years. And this poses a real problem to these young children who are actually bused to school. You get them up at 6 o'clock to put them in the bus to go to school. They're not able to get their 9 to 11 hours sleep. So they're likely chronically sleep depressed through the whole school hours, and they're foggy, they can't concentrate, and maybe the cause of a lot of children not performing well in school, simply because they've not had an adequate amount of time sleeping at night. I mean, there are many people working on the busing system, and even though there are some advantages to it, there's certainly advantages that have not been all positive in the past. Teenage years need 8.5 to 9.5 hours, and even as an adult, the 7 to 9 hours is critical. We say, well, an average of 8 hours, but some people require a bit more than 8 hours and need 9 hours. Others require only 7 hours. So the sleep requirements according to age may vary greatly throughout life. What happens if you're sleep deprived? Well, this gives a very interesting picture of what happens. This is from high school students involved with football and wrestling sports. And you see that if they sleep 9 hours, there may be a 10 to 15% chance of sustaining injuries in these sports. However, it becomes greatly increased, doubles, in the frequency of injuries if they sleep 8 hours, triples if you sleep 7 hours, and more than quadruples up to 75% if you have only 6 hours of sleep. So this is a very alarming and pertinent slide, because it really shows how the loss of sleep can really affect even kids in high school playing sports. This is even more dramatic. What happens when sleep loss is part of driving, and the incidence of accidents is 1.3. This is when you sleep 8 hours, it's 1, an average number, but it increases by 1.3 times if you have only 6 to 7 hours sleep, increases over 4 times if you have only 4 to 5 hours sleep, and dramatically almost 12 times greater chance if you sleep for less than 4 hours. And we're always concerned about truck drivers who don't sleep much, take caffeine and other stimulant medications to force themselves to stay awake, and they're at greatly increased risk. And all of us have had the experience of driving when we're tired, and the incidence of accidents greatly increases with that. And it increases because it's almost unavoidable that you take micro naps, and micro naps are sleeping for 3 or 4 seconds. And if you're driving, that 3 or 4 second micro nap that you simply can't avoid at times is what the cause of the crash is. You may run into oncoming traffic from the opposite direction. You may swerve out of your lane while driving to cause an accident. So the risks and the dangers of sleep loss while driving can be profound. Well, there are 2 processes that control sleep. There is the circadian oscillations and the sleep homeostasis. The circadian oscillation goes back to the caveman days and before the light bulb. And people would wake up when the light came up in the morning, and they'd go to bed and stop doing their activities when the sun went down at night. And so the cycle, the sleep cycle, which takes place once every 24 hours, occurs according to what the availability of sunlight is. And this is controlled by a fairly small nucleus in the brain called this suprachiasmatic nucleus, SCN, which is exposed to light. And 20,000 cells is really a very, very small size, but critically important. And it was great that Edison came up with a light bulb because he prolonged our workday, he made businesses thrive. But there may have been a downside of the light bulb, because it created a whole host of sleep disorders, so that now people can stay awake for all hours of the day and not forced to go to sleep by the lack of the light bulb. So there's certainly a positive, but there can be a negative side of that discovery as well. The second main process that controls sleep is sleep homeostasis. And this is regulated by the accumulation of a molecule called adenosine in the brain. And as many of you may know, that the brain requires energy to function. The body requires energy to function. The muscles require a molecule called ATP, adenosine triphosphate, which is high energy. So ATP is constantly produced in the body. And as energy is utilized, the ATP breaks down to release energy to the muscles or to the brain or to the heart to function, but it releases part of that molecule called adenosine. Throughout the day, adenosine gradually increases, the concentration increases, and it becomes more concentrated throughout the bloodstream in the body, which stimulates the desire to sleep. And what people do when they drink coffee to stay awake, they're really antagonizing the accumulation of adenosine. And so you really lose the sleep demand if you take caffeine or any form of coffee or soft drinks or to stimulate that process. Now, this is a very interesting slide. It's a dramatic slide. Spiders are given various drugs, and you can give them various drugs. But if you look at the normal spider web, it's nice, circular, it has a pattern to it. But then you give them various drugs and that pattern breaks down. But most intriguing is look what happens with caffeine being given. In these spiders, the ability to create a nice circular web is destroyed. So this is how it affects the human brain as well. It just doesn't function as well taking high doses of caffeine or any caffeine. The function just goes down. You're not thinking as clearly. And as you see in these spiders, the precision, the exactitude of what you're doing during the day may be decreased by taking caffeine overload. Well, this is a slide recapitulating what we just spoke about a minute ago. And this is the circadian rhythm. This is the pattern here in the dotted lines that accumulates during the daytime so that in the morning, the drive to stay awake is the greatest. And as you go through the day, you get to the 11 o'clock, 11 p.m. and 12, the drive to stay awake using the process C or the circadian rhythm gradually decreases. So throughout the 24-hour day, you go through one of these sine wave courses where it goes from 7 a.m. one day through the entire wave cycle to 7 a.m. the next day, during which time the stimulus to stay awake is highest at this point, but it drifts off down here. But superimposed on that is the process S, the sleep reducing adenosine. So here is the adenosine concentration that gradually increases throughout the day with the utilization of energy, the release of adenosine. So it gradually increases through the day so that your desire to sleep becomes greater and greater and greater till you reach 11 p.m. And this vertical line, the distance between this point and this point, the height of that line represents the demand to sleep, how urgent you have the demand to sleep. So that here the line is the greatest, so you have a great demand to sleep at 11 p.m. Through the night, the adenosine drops back to normal levels, so that by 7 a.m. it's at its minimum, during which time the circadian process C kicks in as well. And so the height of that line is virtually zero. You have the greatest desire to stay awake at that point. And that pattern is repeated throughout the next 24-hour cycle. And this simply just shows the same thing. So at this point, the height is, this may be at noon or so, and the height is just starting. This may be your desire to sleep after lunch. And the height is very small, but as the height of this pattern here increases by 11 p.m., it becomes much greater. So what happens if you have to stay awake? Well, the circadian rhythm stays the same pattern, but as you go along this adenosine curve, you may take caffeine, and these may be in night workers, people that work at UPS, nurses in a hospital that have to stay awake at night, truck drivers who have to stay awake at night. They may take something to stay awake, like caffeine. So they force themselves to stay awake, and the adenosine gradually rises and rises and rises. But then during that next 6 hours or so, the circadian rhythm comes in here. So you have your second wind. This is where the height of that line is smallest. You have your second wind. You can really, that's when you see more awake. But if you wait another 12 hours, then that becomes an overwhelming, an overpowering urge to sleep. And this is when you crash. You just can't stay awake. Even the caffeine doesn't stimulate you to stay awake any longer, and you crash and you fall asleep. You can't stay awake any longer. So this just shows the risks that one faces by staying awake. Now this next slide is going to show something that we call sleep architecture. And we're going to show the difference in the sleep architecture in the young patients and the architecture, what happens when you're old. But let's just start on the right side of this. And this top picture here is the awake stage. This is when you're awake. This is in the light blue here. And then you get into something called REM sleep, or rapid eye movement. And it's interesting that this was developed probably 50 years or so ago, and with a lot of experiments on children. And when one looked at infants, it was seen that during the night, if you looked through their eyelids, the eyes were moving, and they recognized that they were probably dreaming at that time. So their eyes were following dream states and visions in their dreams, so that the eyes were moving. And then when you got into later phases and deeper phases of sleep, the eye movements would stop. So you ended up in this phase of NREM, or non-REM sleep, which is categorized into lighter NREM sleep and more profound sleep, NREM 2 and NREM 3. So if one looks over this 8-hour cycle, starting here with a 1 hour getting to sleep and spending the whole 8 hours, there are several of these cycles that occur during the night. There are 4 or 5 cycles that occur during the night. So that when a young person goes to sleep, they immediately fall asleep. They pass through the through the REM sleep, and they go into NREM sleep. So this is the phase that the new patterns of passing from short-term memory from the hippocampus to long-term by incorporating the deep thought, they really have a lot of this, and it's very profound in a child or young person or young adult. So they have a lot of this deep NREM 2 and NREM 3 sleep to learn new things and to prepare themselves for the following day. And here it is, there's more REM sleep in the last 4 hours, and this is anticipating for the next day. So that's the normal, healthy pattern of sleep. And it's good to have these deep patterns. But as people get older, the sleep architecture changes, and you're a little bit longer to get to sleep, although not as long as you might think, but it's a little bit longer to get to sleep in the older patient. But look what happens. You have very little NREM 2 sleep and NREM 3 sleep. You almost lose this entirely as you get older, and you wake up frequently. You go through what is called fragmentation of sleep. You wake up many, many times during the night. And there may be, you wake up 6 or 7 times. And there are many reasons that people wake up. They may wake up because they're anxious, or they're depressed, or they worry about what's happening the past day and what's going to happen the next day. They may have physical ailments. They may have arthritis and pain from that. They may have pain from cardiac disease. They may have obstructive sleep apnea. There are many, many causes as one gets older to cause this frequent waking up and the fragmentation of sleep. But it results in a shorter total number of hours sleeping in the older patient than in the younger patient. And it takes you through that whole phase that I mentioned in the very first slide of passing through the stage of damaging the brain because of lack of sleep. So these people, here the fragmentation has shown that people can get back to sleep very easily, but that's not always so. Very often people will wake up, then they have a difficult time to get back to sleep. And they may stay awake for an hour, and then they have to get up, walk around, read a book, and it may be an hour or 2 hours before they can get back to sleep. So this certainly negatively affects the sleep pattern and the sleep architecture of patients. And these patients, as they get older, will wake up earlier in the morning. So they wake up much earlier than the young patient does. And here they're awake at a much earlier stage. And people have often experienced of waking up at 4 o'clock in the morning with only 5 hours or 6 hours sleep. And so that's the sleep architecture that does occur in patients. And this is a pattern to show what happens during these periods of sleep architecture. When you're awake and you do a test called an encephalogram, electroencephalogram, an EEG, the wake pattern is very short. There are brief patterns. And this can be likened to being in a stadium before a concert starts. And everybody's talking, and there's random talking. It's just a blur. Nobody can understand anything. And that's what it sounds like if you put a microphone on, you would hear this sort of constant wave that doesn't mean anything. But think of yourself in a basketball game now, where you have the wave and people stand up and the wave goes around the stadium and people stand up and they go down. So every minute or so, by the time the wave gets around you, you stand up and sit down. And other parts of the stadium does the same thing. Well, that really likens it to the deep REM sleep. This is the slow wave sleep, the slow EEG that occurs in the deep sleep and the NREM 2 and 3 that allows the memories to be instilled into long-term memory. And the REM sleep is very similar in an EEG pattern to that in the awake patient. And that doesn't add anything. So aging and insomnia. Well, what happens in aging? Well, there are several sleep patterns that change, and we've spoken about this. When one goes to sleep, they get to sleep earlier. They get sleep earlier. And as Alzheimer's develops, there's a condition called sundowning, in which there's a change in the behavior. People get to sleep earlier. They become a little bit more agitated. It takes them longer to fall asleep. That's a latency. That's a sleep latency. They have lighter and more fragmented sleep. They don't have the deep NREM sleep. They have more fragmentation at time of sleep. So they have less time in deep sleep. The total number of hours in sleep in the elderly patient is less than it is in the younger patient. So I'll briefly go over something here, which talks about the pathology and the science of the development of Alzheimer's disease. And many of you that have studied Alzheimer's recognize that it's a disease which is accumulation of amyloid beta in the extracellular compartment of the brain, not in the nerve cells themselves, but outside the nerve cells. And these amyloid deposits start developing early in life, probably in the 20s and 30s. It's a normal waste product. It's the garbage of brain function during life. And so there will be a gradual accumulation of amyloid in the brain as people get older and older. And as it develops later in life, there's a cognitive decline as the amyloid beta accumulates, and you get the initial stage of Alzheimer's disease. Then there's also something called tau deposits, and tau, specifically phosphorylated tau, accumulates inside the brain cells themselves and inside the neurons, and that likely follows the accumulation of amyloid beta in the brain. And as amyloid beta develops and accumulates, then you develop tau changes, which occur in the cells themselves. Oops. Backwards here. So what happens to these proteins in the brain, the tau and the amyloid, is that they misfold. They normally have a normal structural pattern, but they misfold and they become diseased as they misfold. So one of the most important discoveries in the last decade, and it really has been in the last decade, which has had profound effects on our understanding of Alzheimer's disease and understanding of sleep, is something called the glymphatic system. It's always been taught that the brain does not have lymphatics, which is part of the system with the arteries and the veins and the lymphatics to remove fluid from the body back to the heart. But it's always been said that that has never existed in the brain. However, about 10 years ago, a pattern was discovered in which they're not true lymphatics, but there are glial cells in the brain. Those are the cells that make up the supporting elements of the brain. So a combination of the glial cells and lymphatics created the name glymphatics. So I'll give you a brief description of this, because this is critically important in understanding why we sleep and why we get Alzheimer's disease, and why sleep is so important in early age. So here we have on the left side here is an artery, and around the artery is a fluid called cerebrospinal fluid, but think of it as water. It's like water. And it goes to the surface of the brain, then can pass through the brain. And what happens here is that the cells of the brain, these may be cells called astrocytes or neurons, they normally function. These are the cells that function during the being awake and alert and thinking and seeing, and they are metabolically very active. And they release substances such as adenosine, such as amyloid, such as tau. And these tau amyloid accumulate in the brain. And there's also another molecule called synuclein, alpha-synuclein, which accumulates in the development of another neurodegenerative disease called Parkinson's disease. So these toxic waste products of metabolism in the brain will accumulate in the brain. And as the patient gets older, they accumulate, they become very, very highly concentrated, and then in 60s and 70s and 80s develop the symptoms of Alzheimer's disease and Parkinson's disease. So let me take you back to this fluid that passes through the brain that washes out these toxic molecules and then carries them to the other side of the brain and washes them out through the spinal fluid and back into circulation. Well, that's what should happen. Intriguingly, however, this only happens at night because during the day, these cells are very swollen, they're large, and they take up all the space. There's no room for the water to pass through the brain to wash out these substances. And this glymphatic system is turned on during sleep. So it's only during the sleep process that this water can wash out the toxic garbage waste products of brain metabolism. And so that becomes a critically important part of sleeping at night. So we're given at night the chance to wash this out. And if you have inadequate sleep at night, these will accumulate. And our theory is now that it becomes one of the big risk factors. And this is why sleep, adequate sleep in 20s, 30s, 40s, and 50s, and even as people get older, is so important because it washes out the waste products. These products don't have the opportunity to accumulate and produce a high concentration of amyloid and tau in the brain, so that by proper sleep, we may be able to delay the onset of Alzheimer's and Parkinson's disease and perhaps even prevent it. So this is why sleep becomes one of the very major parts of the process of this. And this is just another slide that shows the surface of the brain with this water-like structure now shown in gray, passing through the brain, washing out these toxic black waste products, and then taking them back into the venous system and circulating back out of the body. So this is just the importance for cleaning the brain. And this is really just what we mentioned here. The levels of amyloid beta rise in the brain during wakefulness and declines during sleep. The clearance rate of amyloid beta is impaired in Alzheimer's disease, and the glymphatic system is associated with vasculature and astrocytes of the CNS. And so we get the washing out of this, and it clears rapidly through the glymphatic pathway. Really just what we spoke about in that last slide. I don't think that's much. So this is a slide that shows where Alzheimer's develops in the brain. When you get this accumulation of amyloid beta, it accumulates in the brain, and aging will cause damage to sleep, causes damage to the I'm drinking water here, sorry. So cardiovascular disease turns off the glymphatic system. Depression turns off the glymphatic system. not having enough sleep at night or misalignment of the circadian rhythm. Obesity turns off the glymphatic system. Sleep apnea, obstructive sleep apnea, substance abuse, drugs, a sedentary lifestyle, all these things turn off the glymphatic system. And that results in an accumulation of these waste products in the brain, leading to neurodegeneration and dementia. So the current explanation of why we need to sleep is that it maintains activity of the glymphatic system during its time the toxic metabolite products are washed out of our brains. I've spoken a little bit about this. The difference between the aged and youth is minimal, but in the aged population, there is an aggravation of insomnia, and these are the various causes. Heart disease will cause insomnia, pain from arthritis, lung problems, acid reflux, stroke, anxiety, depression. These can all increase the fragmentation of sleep, making elderly patients have trouble getting to sleep, waking up frequently, and waking up early in the morning. I would think that insomnia is much worse in the adult, but in fact, studies show that an 80-year-old patient takes only 10 minutes more to fall asleep than a 20-year-old. Now, there's more fragmentation later on, but there really is not that much difference in actually falling asleep. Well, who needs to be seen by a sleep specialist for insomnia? Well, when the day is interrupted by drowsiness. You need to keep medical conditions under control. And the early treatment of insomnia is to give sleeping pills. These are some of the common sleeping pills that are available, but they should only be used over the short term. Unfortunately, they're not meant to be taken more than 4 to 8 weeks. And what often happens when a patient gets prescribed a sleeping pill, they're on it for years. They become dependent on it, and they're on it for years and years. And when we see patients in the dementia clinic and the memory clinic here in the Norton Neuroscience Institute, one of the first things we do is to take people off these sleeping pills, often with great resistance, because patients don't like coming off a medication that helps them sleep, or that they think that helps them sleep for so many years. There are dangers of sleeping pills. There are many side effects, residual sleepiness during the day. Patients often become dizzy or lightheaded as a result of the sleeping pills that have a fogginess that it can often occur during the daytime. They have sleep-related disorders at night. They may walk, and during the day, driving and eating and shopping, making phone calls. They just can't remember doing these things because of the brain fog that's associated with not sleeping well at night. They're at risk of injuring themselves, and in the elderly population, a risk of fracture of a hip may even be a death sentence, because often it becomes a terminal event when these elderly patients in their 80s and 90s do fracture a hip from falling. There are bad interactions between the sleeping pills and other medications, worsened breathing, obstructive sleep apnea, and poor ventilation. And these benefits will often be overshadowed by the risks of the sleeping medications. Well, when we look at the non-drug treatment of sleep problems, we really think of, well, take caffeine. We take our coffee or our soft drink, our Coke, and we'll stay awake. But that has a risk. Caffeine stays around in the body for hours and hours after it's actually been taken. The so-called half-life, that is the time taken for the concentration of the dose of caffeine to drop to half of that, is almost 6 hours. So if you take a caffeine drink at dinner time, at 6 o'clock at dinner, then half of that is still present at midnight while you're trying to get to sleep. So if you're having trouble sleeping, the caffeine should probably be drank in the first few hours. Probably not drink caffeine after lunch, because some of it will stick around during the day. The average caffeine ingestion is about 200 milligrams. And if you take over 400 or 500 milligrams per day, it may cause serious and adverse overdose symptoms. But just to show you how prevalent caffeine is in our society, if you have 5 shots of espresso, you're taking 400 milligrams of caffeine, really in the toxic range of caffeine ingestion. If you take 5 8-ounce Red Bulls, believe it or not, 1 Starbucks venti brewing coffee is equivalent to 400 milligrams of caffeine, or 2.5 Monster energy drinks, or 11 Cokes. So some of the other methods is to exercise more. This will increase your energy, gives you a positive outlook, healthy weight maintenance. It certainly increases longevity to exercise more. And it releases endorphins, that feel good hormones in the body. Aerobic activities such as walking, endurance are important. Strength training exercises, and don't underestimate the value of strength training. And that doesn't mean to lift 100 pounds, but to get 10-pound bell bars in each hand and use these to exercise with, either by walking or using them several times during the day, is a great way to exercise. The American Heart Association has said that one should even walk 5 to 7 times a week to maintain adequate health and to help with sleep. The food and fluid is another way to help the sleep at night. And we've mentioned the risks of caffeine being taken late in the day. Caffeine taken before bed may keep people awake all night. And I know personally, if I take a caffeine drink at 10 or so at night, it's just almost impossible to get to sleep before 3 or 4 o'clock in the morning. Alcohol is questionable. In some people, it makes them fall asleep faster, but more fragmented. In other people, it keeps them awake. Large meal before bedtime can increase this. And one of the problems that we face in eating at night is that the brain has a difficult time differentiating what is fatigue and what is hunger. So that when you're really feeling tired, what you may interpret that to be is feeling hungry. So you go to the fridge and you take out food at night. So you're really eating food, not because you're hungry, but because you're tired, and the brain is not good enough, smart enough to differentiate the two sensations. So that's important to be able to separate and not eat at night before you go to sleep, because it's the worst time to sleep. So daytime exposure to the sun is very important. Must be more exposure to the sun is very important. Melatonin comes in here, and many people are melatonin addicted. And it's perhaps a safe drug, but whether it really helps it with sleep is very controversial. And when one does large studies and reviews the literature on this, it's really not a proven fact that melatonin has any role to play in helping people get to sleep. And in our own clinic, we have arguments about this almost on a weekly basis. But certainly plenty of sunlight, synchronizing the circadian rhythm is very important. Spend more time in the sunlight, but very important. And then to develop sleep-friendly habits. Give the body the proper signals to go to sleep. And these are simple methods to help with sleep, but so often overlooked. Go to bed and get up at the same time every day. This reinforces the body's sleep-wake cycle. Take a warm bath or shower, reading a book, not watching TV. TV and computers have blue light waves and really are a stimulant to stay awake. So these are bad things to do right before getting to bed. When people watch the late news and they try to get to sleep and they can't get to sleep, you just can't do that, because it's one of the things of staying awake much longer. If you don't fall asleep in 15, 20 minutes, get up and read and eat and not eat or watch TV. These are damping effects to falling asleep. Other sleep-friendly habits are relaxing, try to avoid the worrying, planning, thinking, hard to do. Sometimes medications are required to help out with these medications. Progressive muscle relaxation. These are techniques that can be used before bedtime, trying to get to sleep. And people know these use visualization, and often people would use smell and sight and sound. They have these sound waves on their computer or their cell phone that has the sound of beach waves that help them often get to sleep. Mindfulness and medications are becoming more important in the understanding, and there are very many apps on the cell phone to help out with this. Cognitive behavior therapists can also be very helpful in getting people to go to sleep. And if you really have a chronic sleep deprivation, sometimes help with a professional psychologist can help you get to sleep. I've mentioned the melatonin story. Take for less than 2 weeks. It probably doesn't have a long-term effect. However, often becomes a placebo effect. People think it's of value later in life, but it really isn't. People have looked at sleep scores, the amount of time in bed, and that your sleep, this measures the sleep efficiency. And the higher the score, the better and more consolidated the sleep is. And if a loved one or you yourself snore with home remedies, it's important to try to avoid these snoring. This not only is important in helping people sleep, but it does increase the risk of strokes and heart attacks. If you're overweight, lose weight. This is very important. And if you sleep on your back, one way to avoid sleeping on your back and snoring is to put a tennis ball at the top of your pajamas, tape that in, and you really won't be likely to sleep on your back. Raise the head of the bed. Nasal strips, so that pharmacies can open the nasal passages to allow breathing to occur more easily at night. Treat nasal obstruction, limit or avoid alcohol and sedatives, quit smoking, and get enough sleep. So this, I think, is the last slide. And if snoring is a problem, then you may need to see your physician for it. If you make noise during sleep, it's really important to have something done to look at that. That's the snoring. Excessive daytime sleepiness. Often people have to sleep 3 or 4 hours a day. It's okay to sleep in the daytime. It's okay to have naps. That may help you get closer to the 8 to 9 hours sleep. But the naps during the day should not last more than 30 minutes at a time, and no more than 2 of those should be taken during the day. If you have a brain fog, you have difficulty concentrating in the day, that's very important to allow to get to a physician to perhaps look at what may be causing that. Maybe that you're on the wrong drugs, you're on medications, you're on sleeping pills that are creating this brain fog. If you have morning headaches, you wake up and you're still tired in the morning. Restless sleep, gasping or choking at night, high blood pressure. These are all things that you should do to seek medical opinion. Don't just pass it off saying, oh, well, I'm just getting older, or it doesn't worry if I snore at night. Yeah, it may be a critically important thing, because the incidence of stroke with snoring, it's thought that the vibration causes carotid artery stenosis in the neck that can certainly lead to stroke. So anyway, that's all I have to say about sleep. And if there are any questions, I'd be glad to answer those.
Thank you. Very